Okay, so I just have a few slides kind of sharing more about what we've been doing at regional level to support this agenda and some of the kind of learnings and findings that we've found through our mapping work as well. But I'll whiz through these so that we have time to hear from each of the project presenters. So improving access to personalised care across secondary care in London is a key regional priority and area of work. And as part of this, we have been aiming to share and spread innovative and impactful examples, improving access to holistic support in secondary care. We've also been aiming to support sustainable and integrated pathways that support that continuity of care for patients as well. In terms of what we've been doing so far, we've been mapping where social prescribing and personalised care are supporting secondary care patients, and I'll share more about the findings from that work in these slides. We've also been developing key case studies on our website for innovative and exciting pilot projects, and we've just shared the link to that in the chat, so you can go look at that as well. We've been providing direct support and resource to pilot projects in development, in particular through planning, co-production and evaluation. And we've also set up a pan-London community of practice for anyone interested or involved in expanding personalised care roles in secondary care. Then going forward, we're hoping to support the development of resources that support the system to embed and expand personalised care roles in secondary care, to continue supporting integrated neighbourhood teams and partnership working, and also supporting the development of a strategy to expand personalised care roles in secondary care. So, as I said, we've developed a pan-London community of practice or network to champion and support the development of integrated and sustainable approaches to improve access to personalised care in secondary care across London. So you can see more there about who's involved, the activities, what we've done so far, and what's next, as well as how to get involved. Just to say, we'll be sharing all of these slides afterwards as well, so you can read more on those there. But I did just want to share a bit more about some of the learnings that we've mapped so far. So personalised care interventions in secondary care, there's not one uniform model. There's loads of different cohorts that can be supported and loads of different referral pathways and service models, as you can see there. Also, due to there being a lack of funding and policy for personalised care roles in secondary care, there's often discrepancy across the system in terms of job titles, descriptions and responsibilities. For example, you can have community connector roles, care navigators, etc., which are often doing similar functions to social prescribers. Also, we know that due to issues with capacity and lack of established pathways for referral, facilitating that referral from secondary care into the community can also be quite challenging. As part of one of the community of practice sessions, we also collectively brainstormed what we were aware of in terms of personalised care work across secondary care in London. And this helped us to map out different specialisms and cohorts that are commonly supported, different personalised care service models, and also referral pathways. So I won't go into detail about that, but you can read that through when we share the slides. We also know that it's really important to thoroughly evaluate personalised care interventions in secondary care in order to really demonstrate the impact and the value to funders to secure future investment, to ensure that pilot projects can be sustained and scaled beyond 1 or 2 years, and also more widely to demonstrate why personalised care should be considered business as usual and embedded across all health and care services. So you can see there as well some more examples of evaluation methods and funding models that have been used in different secondary care personalisation services. So London is leading the way in embedding personalised care support in secondary care. So I've highlighted a few examples here. For example, in North West London, 2 pilot projects used community champions and wellbeing coaches to provide community-based alternatives to high-intensity users of emergency services. And actually, one of those pilot projects saw a 41% reduction in clinical contacts. In Barts Health Trust, a social prescribing link worker has been embedded in the Royal London Renal Department to support children and young people with long-term conditions. And also Niche are funding a 5-year programme of research to embed and evaluate a health coaching and social prescribing intervention for people living with HIV. We also know that many of these projects are already achieving huge impacts. So as you can see, a high intensity user service using care coordinators in North Middlesex University Hospital has led to a 30% reduction rate in emergency department attendances. In Southwest London, a Macmillan Community Link Worker service has led to increases in life satisfaction and well-being and decreases in anxiety. And finally, a project in Northwest London as well, which you'll hear more about from the project leads in this session today, but supporting patients with chronic pain led to a reduction in referrals to secondary care through providing more appropriate support in primary care and in the community. But before I hand over to our project leads to share more about each of their projects, I just wanted to introduce Slido again. So my colleague Beth will just pop the link in the chat. Thanks, Beth. And yeah, there's some questions in there because we'd really like to hear from you around what you think the most important factors are to consider when introducing personalised care roles in secondary care, and also what the biggest benefits could be as well.